Part 2.
Taylor Greene, she's your colleague over in the House. The way she frames this is she says Democrats created this mess, but Republicans don't have any solutions to fix the healthcare issue either. Is she someone that you could see yourself working with?
On what?
On the healthcare.
I mean, listen, I think people can talk a good game, but until they actually support policy that helps people, I'm not particularly interested. But if she actually wants to support legislation and expanding healthcare, I've worked with plenty of Republicans as well on healthcare. I have a bill that I've introduced with Congresswoman Malliotakis, a Republican from New York, on expanding maternal health and reauthorizing the Healthy Start program to help newborns and new moms be able to support their kids. And so in terms of bipartisan legislation on healthcare, I'm more than open to doing that. But it's not just about talking the talk, we gotta walk the walk.
And you would need to see her actually support something that you're behind in terms of legislation on healthcare.
Yeah, particularly as a TSA employee, I represent LaGuardia Airport. And so yes. I know very, very well all the hard work that you all do and put in. And,
yes, ma'am.
And you all deserve a dignified workplace. You deserve a safe workplace. And you deserve the paycheck that you are working for. What I believe the best thing that we can do is to reopen the government right now, and to ensure and to also call on our representatives and put pressure on individuals like the Speaker of the House to actually pick up the phone. The problem here is not that there is not even that there's a disagreement. It's that the Speaker of the House and the Trump administration refuses to even have a negotiation. They refuse to even pick up the phone and talk about this. And so I do not want us to start to agree with what Mike Johnson is saying and to have them preview for us and normalize the idea that everyone's just going to miss a paycheck, that 1 million federal workers are just going to go without that, and to just warn that in advance and to have us accept that. This is not acceptable. This is not normal. And what is normal is for us to negotiate. When one party wants the votes of another party, you negotiate, you come to a compromise, and you pass a bill. That is schoolhouse rock, and that is how things should be. So I thank you for that, and I want to make sure that we, of course, pass a bevy of federal protections for workers, but we don't want them to be necessary in the first place. Now, well, we already know, and this is a common lie that Republicans have been repeating, that this shutdown is about Democrats trying to provide health care to the undocumented. And we already know that it is federal law and federal statute that undocumented people cannot be covered by the ACA, they cannot be covered by Medicaid, they cannot be covered by Medicare. Period. That is the law of the land. There are plenty of federal laws on the books. Now, the vice president has been trafficking this other misconception, saying that the emergency Medicaid program is providing health care to undocumented people. That too is a complete, just, I don't even know, whole cloth storytelling, we should say. The truth of the matter is that we have a federal law, as it should be, that any person who walks into a hospital in desperate need of medical attention receives that medical attention regardless of their insurance status and regardless of who they are. And I don't know about you, but me as a human being, I don't want to live in a world where if a human being is struck by a car or is getting rushed into a hospital, that the people in the ER surgical room are asking for your insurance information or asking for documents before they save your life. The problem is that this administration, the Trump administration, folks like Russ Vought, they think that destroying our health care, making sure that housing is too expensive to live in, that jacking up the costs of our groceries, they think all of this is about hurting Democrats. What they are doing is hurting Americans, and they are hurting this country. And if Mike Johnson wants to say that this shutdown is going to last a long time, it is because he is choosing to punish the American people, and we cannot stand for it, and we cannot allow it. And we also cannot enable it by acquiescing and enabling the behavior of bullies. So it ends today.
Let's say that the White House and Republican leaders say that they will extend these subsidies. It's not clear how long, because you say 1 year is not enough. They haven't even really put that forward yet. I think the question is, does that need to be enshrined into law? What does that need to look like before you would vote to reopen the government? Or is a commitment from the White House and Republicans enough?
No doubt.
I mean,
Mr. President, is a very honest man. And if he says something, man, you could take it to the bank.
So you're saying his word is not enough?
Bankruptcy court.
His word? No.
So what do you need to see? What commitments from?
I think we need to see ink on paper. I think we need to see legislation. I think we need to see votes. And I think we need to see these things pass on the floor of the House and the Senate and signed by President Trump. I don't accept IOUs. I don't accept pinky promises. That's not the business that I'm in.
Okay, so you need a signature from President
Absolutely.
Trump in order to vote to reopen the government.
Hi. On the issue of healthcare, a lot of the clinics and hospitals that are negatively affected the most under the One Big Beautiful Bill are located in rural, mostly Republican areas. A lot of the increases in Affordable Care Act premiums that Democrats are fighting to prevent are concentrated in more rural Republican areas. If the Republicans are so insistent on sticking it to their own voters on this issue, why don't the Democrats just let them?
Mm-hmm. I mean, I think Alexandria touched on this before, and that is, we are, one of the things, and this really annoys me about Trump, he's dividing this country. Why would I not? When we hit the road, we were in Idaho, right? Mm-hmm. It's the most conservative state in America, I think. We had many thousands of people coming out. We are Americans. Mm-hmm. What, you think I would feel okay if somebody in a Republican state died because they couldn't get health care? I would hope not. I would hope nobody feels that way.
And I think it also speaks to a big difference between someone like Trump and someone like me or someone like Bernie, which is that Trump believes that if you don't vote for him, he doesn't have to be your leader. That if you didn't vote for him, that you don't deserve good things to happen to you. I don't care if someone voted for me or not. I don't care if someone is a Republican or an independent or a Democrat. I don't care if someone likes me or not. That will never change the fact that I'm going to fight for them to have health care. I want MAGA to have health care. I want MAGA to be paid a living wage. But he doesn't want people who are Democrats, or he doesn't want people based on their political affiliation to benefit. And that is the difference between a strongman and an authoritarian and a leader of a democracy.
There you have it.